Hey guys, my name is Lauren, and today on my YouTube channel, we are talking all about what to do if you are trying to work with a resistant client. If you're new here, again, my name is Lauren. I am a licensed clinical social worker, board approved supervisor, and private practice owner. And while I'm not your clinical supervisor, I do feel like that everybody deserves to have a good clinical supervision experience. And oftentimes I find that certain things in supervision are lacking, and people are trying to go through the licensure process, or they're newly licensed as a mental health professional and they feel like that they don't know what they need to know. They are searching for what to do in this situation, and they really need to have more knowledge and skills in order to help them feel more confident and competent in their ability to practice as a licensed professional. And so this is where my YouTube channel comes in. Today we're talking specifically about what to do if you have a resistant client, but we talk about lots of different topics on my channel. So if you haven't already, please subscribe and follow along so that you don't miss anything, because we cover a full range of different mental health topics and skills that I think everyone should know and be practicing in order to provide good clinical services. Alrighty, so today we're talking about what to do if you find yourself working with a resistant client. Now, this can be particularly uncomfortable and even intimidating for someone who is pre-licensed or even newly licensed. And I actually see this come up a lot when I am providing supervision to supervisees, which is they don't feel very confident in their ability to address the elephant in the room, which often is the client is resistant, or they're doing something that appears to be resistant to change or growth or to move the work forward. And they don't know how to address it. They don't know how to bring it up. They don't know how to be assertive and communicate what they're noticing in a way that will hopefully help the work move forward. And so they just feel stuck. So today we're going to talk about three parts. One, how to recognize that a client is being resistant. Two, what are maybe some reasons that the client is showing up that way in a therapeutic setting? And then three, what to do about it so that you can hopefully help the client continue to move forward and ensure that they're still reaching their goals. As always, everything that is said on my channel is for strictly educational purposes only. Nothing that I'm talking about constitutes a replacement for good clinical supervision. So please make sure that you're seeking clinical supervision and you're talking to your supervisor, because you deserve to have the best clinical supervision experience as you possibly can. All right, so let's talk about first how to spot this. Now, this may be really easy for you to spot, but it also can show up in some sneaky ways. And so I want to make sure I'm just covering the basis so that everyone's on the same page. So if you're working with someone and you're wondering, is it possible that there's something going on in the room that's causing them to be resistant, or maybe this behavior is questionable and is it resistance? I don't know. Let's talk about what that actually might entail. So I oftentimes see someone is resistant to something, to change, to having a conversation about something, to processing trauma. There's a resistance in some way. And oftentimes that resistance can show up in they're not very open or forthcoming in what you're asking them to talk about. There might be some guardedness. There might even be some defensiveness that shows up. And it's not in a necessarily negative way, but it's in a I'm trying to protect myself way, because I'm feeling resistant to go there to talk about it, what have you. And so it's coming up as defensiveness. I also see where if someone is resistant, they may not be able to say that they're resistant to that change, but they're doing things and using behaviors that are making them go all around the work and not really addressing the core issue, which may be the thing that you're even able to see, like, hey, we need to talk about this, or we need to work on this in order to grow and to evolve and to make sure we're reaching your goals. And what that might actually look like is they're saying that they want to do something, but then their behavior does not necessarily match. And so they say, yep, I really want to work on that coping strategy, or yes, I think that would be really helpful to communicate that to my partner. And then they come in next week and you ask them about it and they're like, oh no, this came up. And all of a sudden there's a lot of reasons as to why they didn't do it. That oftentimes is a key sign that something's happening that might actually indicate that they're resistant in some way. Now, clients don't necessarily always consciously understand, hey, I'm resistant to this, and so I'm not doing it. But we, as the mental health providers, need to be able to spot this and to help them understand how this is showing up and impacting the goals that they're trying to achieve and how this behavior might be problematic or it's standing in their way. And then we have to also be able to help support them in addressing that and overcoming it so that they can still move the work forward and get to where they want to be. Bring this up because sometimes I find that as mental health providers, we can become frustrated if a client is not following through with things or saying one thing and then doing another, or they seem to be kind of stuck in this cycle where there's a problem that's identified, we talk about it, we try to come up with a solution or some goals that you can work on to help you address it, to make change, and then the cycle just kind of starts back over the next time that we see each other and we're in this loop. This can be really, really frustrating, but it oftentimes is a signal that the client is resistant in some way. And it might just be the client's just not really ready to go there. They're saying they're ready to go there, but then in the moment, they're like, no, I'm not feeling confident. I don't know if I can do this. I'm worried. I'm apprehensive. And so they're just not following through with it. But this is not an intentional, I'm intentionally not doing what I say I'm going to do. It oftentimes is more about I'm resistant in some way. I don't necessarily realize that, or I can't really put that into words. And I want to do the thing, but change is really hard. And so I'm showing up in a way that seems like as a client, I'm resistant to change and I'm not following through with things and I'm just staying stuck. But it doesn't mean that I'm intentionally wanting to do that. And oftentimes I see people don't intentionally want to stay stuck, but they find themselves stuck for one reason or another. So if you notice that a client seems to be kind of spinning their wheels or sessions seem pretty repetitive, like we're not really moving forward, it's the same thing. If you notice that they seem to say they want to do something, but then they struggle to follow through with things, if you notice that they don't want to talk about certain things, or they're really quick to sidestep to a different conversation or to minimize certain things, all of these might be signs that they are resistant in some way to change, to having hard conversations, to really addressing things that maybe are very traumatic or hard for them to talk about. And so we want to be able to spot this so that we don't unintentionally just kind of keep moving forward and keep trying to drive the work forward and not picking up on their cues. If we can spot that this is happening and we can pick up on these different cues that they're giving us, then that actually gives us a really good opportunity to slow down for a minute and tune into what they're doing, what they're saying, and what they're not saying, and to talk about that and actually have a conversation with them in a way that is supportive and understanding, and also coming from a place of curiosity and saying, hey, I'm noticing this is really hard for you to talk about, or I'm sensing that you don't really want to address this big issue, or I'm noticing that when this conversation comes up, it's hard for you to talk about. Is that something that you are aware of? Help me understand what's going on here for you when I say things like this, or we start talking about this topic over here. We want to seek to understand what's happening for you that is causing you to feel, I don't think I can do this. I can't go there. I can't talk about it. This is uncomfortable, because something's blocking you. And I want to be aware of what that is so that I can better help you. But I can't even begin to do that if I am not really understanding how this is showing up in the work. So that's the first big thing. We want to be able to spot the resistance and understand what's happening in the moment. The second thing we want to do is we want to understand why there is resistance to begin with. And it kind of goes to what I was just saying a minute ago. From a place of curiosity, not a place of judgment or shaming, I want to seek to understand, why is there resistance happening in the moment? Because it is impacting the work, and we need to address the why in order to better understand how we can move forward and how I can support the client in overcoming things that are hard, things that are challenging, things that are really sensitive, and get them to where they want to be. I always like to say, come at it from a place of curiosity and have a conversation with the client once you notice that these things are in play, and seek to just understand better what it is that they're going through. And so I gave you a couple of suggestions earlier on how you might word that. But some other things that you can kind of say would be things like, hey, I'm noticing X. I'm wondering what's happening for you in the moment that's making it challenging to talk about that with me. It could look like, hey, when we talk about this thing over here, I noticed that you shut down. Let's talk about why that might be happening. Do you have any insight on what's happening for you in that moment that's causing you to shut down. Again, I'm not coming at it from a place of, hey, why aren't you talking about this? Right? Like, please don't do that. I want to seek to understand, and I just want to come at it from a place of, I'm genuinely curious, like, what's tripping you up? And how can I help you get to a place where that's not tripping you up anymore? And we want to also remember that change is really hard. And I might be looking at it from my own perspective, most likely, and thinking, just do it. Just do the thing, just make the change, just do the homework and you'll see like this is really helpful. But we have to respect the fact that change is hard. And so a client in session saying, hey, I think this would be helpful, and then actually applying it are not the same level of difficulty. Saying I'm willing to try it is not as difficult as in the moment working against all the things that are comforting and that are just habit for you, and pushing through that and getting uncomfortable and doing something that maybe you've never tried before, or you're not even feeling confident that might or might not work out. But in order to move the work forward, we know that clients need to be able to do that to reach their goals, but it's still, change is really hard. We always want to keep that into perspective, because we might just be coming across a situation where the client really does want to change, but the change is really hard and it might actually require a number of other things to change in their life, and they're just not there yet. And sometimes that's just the case. The clients they're just not there yet. The last piece that I wanted to mention about the why is we also want to keep in context of, why are they sitting in front of me right now? Are they court ordered? Are they coming because their parents made them? Are they here because they are being required to do it for X, Y, or Z reason? Are they really bought into the work? Because sometimes resistance shows up because the client doesn't want to be there, or they don't feel like that the issues that are present to maybe other people are things that they want to work on, or that are even problems to begin with. And I oftentimes see clients specifically who are either being in some way forced, whether that is it's court mandated or court ordered, or their parents are forcing them to go to therapy or whatever, that there is some just initial resistance because no one wants to be told what to do. I don't know about you, but I don't want to be told what to do. And so I want to always keep that in mind when I'm working with a client, because clients don't want to be told what to do. And if I'm in any way feeding into that narrative that you need to listen to me, or that you need to do what I say, it can just naturally be off-putting for other people, and there's likely to be some resistance there. So I want to keep that in mind too. And if that is happening, then we also want to address that. So let's talk about what to do if you have now realized this client is resistant, and we've started to kind of uncover why there might be some resistance here, some different reasons for that. And yet I'm supposed to be helping the client. So what do I do now? We were just talking a second ago about the client who is being asked to go to therapy, right? I say asked because if I'm being court ordered, or my parents are saying you need to go talk to a therapist, then that's not really being asked, that's being told. And there's going to be some just negative connotation naturally that comes with being told what to do, or that you have to do something, because it takes away your autonomy and your choice. So we want to normalize that if that's the case, and just acknowledge that, hey, I bet it's hard to come here and to talk to me when you're being told by your parents that you have to. Or I'm wondering if it's uncomfortable for you to come in here and talk to me about this stuff, as your parents are the ones who have said that you have to come to therapy. Or I'm wondering if it's hard to talk to me because you know that I'm going to be telling your parents, or going to be telling your probation officer what we're discussing. Is that something that's a concern for you? Right? So I want to just call attention to the fact that, hey, there might be something happening here. If there's not, as a client, correct me. But if it is, let's just talk about it. Let's just bring it up in the open and just have a conversation about it, because then I can help you try to figure out, okay, so what can we do to help you feel more comfortable and less resistant, and still comply with whatever you need to comply with in order to maintain in good status, whether it's you're being court ordered or your parents are telling you, and okay, so how can we get your parents off your back type of deal. So that's the first piece. The second piece would be to really try to look at, okay, let's see what the goals are. Let's see where their kind of barriers are right now. What's kind of keeping them, hitched up from making positive change. And then let's see if we can come up with a plan to address the issues, but make it more realistic for them. Because sometimes we might be working with a client and their goal is way up here and they're just not ready, or they haven't made other changes in their life. And those changes also have to be made in order to support their ability to reach the goal that we've set way up here. And so sometimes it can look like, let's just kind of scale this back a little bit. Like, I know this is our end goal right up here, but right now, could we figure out how to get one step forward instead of maybe 10 steps forward? And what might that look like? And actually have a conversation with the client to kind of come up with a plan of, maybe this is just not in the cards right now. Maybe this is really challenging, or other things have to be addressed first. And so what might those other things be? And let's address them. I love having conversations with clients about, hey, like, what barriers do you feel like are keeping you stuck or keeping you from making this change or to following through with things? And whatever those barriers are, do you feel like it would be helpful if we addressed those first before we got to the bigger stuff? And can we kind of piecemeal this, where let's try to address this barrier first and then this barrier second, and then let's slowly address things over time to get you to that place. We're still moving forward, but we're taking it in more bite-sized pieces. I find that can often be really, really helpful, especially if clients are experiencing a lot of barriers. Like, I want to have better communication, or I want to better manage my anger, but my mom is continuing to be a trigger for me, or I have no one to talk to outside of therapy, and so I feel like I just explode on the first person I talk to, or I don't really have a lot of coping strategies, or I feel like I'm not getting the support or the tools I need to do this over here, right? So I have to be able to address that first before we move forward, and that just comes down to, we need to have a kind of a solid foundation before we make really significant change. And so sometimes that can help with that resistance a little bit and get clients more bought in, is let's just kind of take this back a little bit. Let's take it down to more manageable parts. Let's stop focusing on the big goal for just a second, because it's really hard for you to reach. It might even feel unrealistic or unattainable right now. And let's just address what's coming up for you and what's happening in the moment. Now, you also might have some resistance for clients who they're really just struggling to connect with you and to build rapport. And this is something that I hope that you were really focusing on in the beginning of session. But if you're noticing, hey, we've had a couple of sessions and this is still a client that I feel like is hard to reach, then I would actually really focus more on the rapport building and getting them to know, like, and trust you. Because if they don't know, like, and trust you, then it can just naturally be hard to go there and talk about things that are really challenging, because we need to be able to trust people in order to do that. So I would kind of go back to the basics and just focus on, okay, let's make sure we're building good rapport. I want to make sure that I am using good listening skills, that I'm being empathetic, that I am summarizing what they're saying so that they know, hey, I'm hearing them. I'm really trying to tune into what their pain points are and what they're saying and not saying, and addressing that to help them really get the sense of, I'm listening, I hear you, I'm with you. I also want to make sure that I'm conveying the message of, hey, we're doing this on your time and in your way, whatever you feel like is helpful for you. I'm not in the driver's seat. I'm not trying to tell you what to do, because even just having that conversation alone could be a breath of fresh air for some people, of like, okay, they're not out here trying to tell me what to do. They're not judging me. They're not forcing me to do this. Like, I have say here, which can be really helpful. Another thing that you could try is make sure you're reaching them where they're at. And so kind of goes back to building rapport. But if I have a really hard to reach client, I might try to change some things up, and I might try to come at it from a different perspective in a way that I'm really reaching them and who they are as a person. And so if I know that this client likes anime, or they really like gardening, or they're really into fitness, or they love playing basketball, I might try to do something in the work to incorporate their interests so that they have more of a buy-in, and so that they know, hey, I'm really trying to kind of reach you where you're at. I'm not trying to talk over you. I'm not trying to give you a bunch of jargon. I'm not trying to act like that I'm superior, right? Like, I want to come at it at your level. And if I can relate it in some way to something that's of interest to you, then I might be able to get you a little bit more invested in having the conversation and talking about things and just really meeting you at your level wherever you might be. So that's another thing that you can try, is really trying to incorporate their interests and get them to have a little fun, right? Like, we're also in a situation where we're talking about really hard things. And so if every session feels like I need you to come in, it's very sterile, I'm expecting you to just talk about your trauma, and I'm just sitting here going, yeah, they might be resistant to really do that and to go there and to do anything to move the work forward, because that just sounds like a really sterile, not fun, not warm, not welcoming environment. But if I could relate things to something that you like and use that as a way to build rapport and make you feel more comfortable, then there might be naturally a little bit of a guard that's let down, a little bit less resistance to talking about things and to working on things. And then we can really do a lot of work. And then the last tip that I have is make sure that you're managing your own agenda. We all, I think I can speak for everybody in the situation, I hope, we all want good things for our clients. We all want the best for our clients. If you don't resonate with that, I think you should change professions because we have a job where we are supposed to be supporting the client. And so we all want good things for the client. We all want what's best for them. But sometimes what I find is that actually causes us as a professional to have our own kind of agenda or goals or idea of where the client should be or what they should be doing, because, hey, as a professional, I'm looking at it from an outside perspective, and it's very easy to see, hey, if you did this or you stopped doing this, it could potentially solve your problems. But things really aren't that simple, and it's always easier as an outsider to look in and go, oh yeah, I think you should do that. But it's another thing to be in that client's shoes with their support system, with their coping tools, with their history of trauma, and really try to make change. And so I want to make sure that my agenda doesn't eclipse the client's agenda, because there's naturally going to be some resistance there if a client feels like you want something for me that I don't want for myself, or that I'm not really ready to do, or that I'm not even bought into the fact that it might be helpful. And I know that you might be thinking, well, why wouldn't the client just say that? It can be hard to say things. It can be hard to get uncomfortable. It can be challenging to talk about the elephant in the room. It can be hard to advocate and speak up for ourselves. And so don't expect the client to just automatically come out and say, hey, you seem to want this, and I don't think that that's best for me. You might have those clients that do that. But what I have found is that a lot of clients feel uncomfortable in that therapy space, challenging the therapist and saying, hey, I don't really know if I want to do that, or I don't think that's helpful, or you feel like you're kind of forcing me, or it just feels like you're not really listening to me. Like, it can be really hard to say that. And so even if a client's not saying that, that doesn't mean that we're not potentially coming across that way. So we always want to make sure that my agenda doesn't eclipse the client's agenda, because if so, I'm naturally going to be met with resistance, because I am trying to push them in a direction that they're not ready to go in, that they don't want to go in, that they don't feel confident yet in themselves to go in, that just doesn't feel like it's right for them, whatever it might be. So we always want to make sure that we keep that in check, because that really can do a lot of damage to the client and just naturally make them show up as resistant. And in case I haven't said this clear enough, a difficult client and a resistant client are not the same thing. It can feel like, man, this client is really difficult to work with, or they're really challenging, or they're even frustrating to work with. But that actually has nothing to do with the client's resistance. That has to do with my own feelings and the way that this client is making me feel about them. A resistant client isn't trying to be difficult. A resistant client isn't trying to be frustrating. They're resistant because of some reason or variety of reasons that's causing them to feel like it's really challenging to do what you guys are trying to work on. And we don't just say, okay, well, sorry, I can't help you. We have a duty to continue to help and support that client, but we also don't want to fall into a situation where we're ignoring the resistance. And so we want to address it in an assertive, respectful, open way where the client feels like, hey, we can talk about this. They're trying to support me. They're trying to understand, and they're noticing these things, and they feel comfortable enough to bring that up to my attention so that they can help me address whatever these barriers might be. So we want to bring it up. We don't want to shy away from this. And we also don't want to get in our heads of like, oh, they're just a difficult client, or oh, they're just impossible to help or to work with, because those things are so far off base. You can do a lot of work with a client, even if at times they feel resistant. It doesn't mean that we can't move the work forward. It doesn't mean that I can't help you. It doesn't mean that you're a lost cause. Like it doesn't mean any of those things. In fact, I caution you if you ever start thinking those things, because we really want to take a step back at that moment and seek some clinical supervision and really figure out, why am I having such a strong reaction to the client? And what do I need to do to address how I'm feeling and the way that I'm thinking about the client, so it doesn't do harm to the client or impact the work that I'm supposed to be doing. But this is not a client who is trying to be intentionally defiant. We're talking about a client who is resistant to change for one reason or another. This might be due to like pre-existing conditioning. This could be due to unhealthy coping tools. This could be due to other big life changes that they're just not ready to make yet. They might not even be aware of this. And so we want to first identify, again, what's happening in the moment and be able to spot potential signs of resistance. The second thing that we want to do is make sure that we are being curious and seeking to understand from the client what's happening for you, what's making this challenging, what's making you feel resistant to this. And then we want to go into the third thing, which is, okay, so how do I help you? Because I'm not going to abandon you because of this. I'm not going to wash my hands of you because of this. I want to make sure that I'm helping you. And so we just have to get creative and try the steps that I provided. And as always, seek clinical supervision. Talk to your supervisor about specific clients that you have in specific cases, because every situation is so different and unique, and there's lots of different things that you can try. We don't want to immediately just go, oh, well, you're resistant. All right, well, come back if you ever need help, right? That's not the first line of defense. We want to respect, obviously, that if the client's like, I am in a place where I don't want to make any change, then okay, I respect that. But I don't immediately think, okay, they just must not want to change, and then say I'm going to write them off. It's not going to feel good for them. And I would imagine it wouldn't feel good for you if someone did that, if the roles were reversed. So we want to stay empathetic. We want to stay curious and understand. And we want to continue to try different ways to help them, so that hopefully we can work together, me and the client, to feel that they're less resistant, that they're more confident, that they're more comfortable, that we're addressing other barriers that might be happening in the moment, and that they can get back to the work and continue to reach the goals that they have set for themselves. I hope that something in this video was helpful for you. I gave you a lot of different tips and little nuggets of information to think about and to help hopefully continue to move the work forward and to support your clients. If you're new here, make sure you subscribe and follow along so that you never miss anything, because on my channel, we talk about a full spectrum of different mental health topics and the things that come up while you are trying to become licensed, and even tips and tools that you can use once you become licensed to make sure that you feel confident and competent in your clinical skills. As always, as well, if you have any questions, please make sure you leave them down below, and hopefully I can answer them for you. Until next time, bye guys.